you, Lisa, and good afternoon, everyone. I'd like to begin today with an update on this week's reporting and our media briefings, as well as a reminder about an upcoming change to the restrictions exemption program. As the number of cases and hospitalizations continue to go down across the province, we are reducing the frequency of these media briefings. Starting today, COVID-19 media updates will be held once a week on Tuesdays. Numbers will continue to be posted online Monday through Friday and shared on my Twitter account as usual, and we will provide additional updates if any emerging issues arise. As such, this will be my only COVID-19 media briefing this week as we mark Remembrance Day on Thursday. Remembrance Day is, of course, an important time where Canadians come together to honour the service and sacrifice of those who served and continue to serve our country. To help organizers host safe Remembrance Day ceremonies this year, we have posted guidance online at alberta.ca. I'd also like to remind Albertans attending any ceremonies in person to be mindful of the physical distancing, masking, and capacity requirements in place to prevent the spread of COVID-19. And as always, if you have even minor symptoms, please stay home. Please also make sure to check ahead to see if the venue is participating in the restrictions exemptions program, and if so, make sure to have your proof of vaccination, privately paid for negative test or medical exemption handy. Speaking of the REP program, as we work together to stop the spread of COVID-19, I'd like to remind Albertans that beginning Monday, November 15th, Albertans' vaccine record must include the QR code in order to enter any business or venue taking part in the program. This means Alberta vaccination records without a QR code, including paper immunization records received at your vaccination appointment, will no longer be accepted. The exception to this is First Nations and military vaccination records, which will continue to be accepted. If you got your vaccine at an AHS clinic, a pharmacy, or a physician's office, in Alberta, getting your new QR code is quick and easy. You can visit alberta.ca/COVID records to get your QR code and either save it to your phone or download it and print it off. If you need assistance accessing or printing your record, you can visit a participating registry office where they will print it off for you for free, or you can call 811 to have your QR code mailed to you. If you were recently vaccinated, it may take up to 2 weeks for your online records to be updated with the latest dose. If it's been longer than that, and there is a dose missing or there are other issues with your record, please visit alberta.ca/COVID records help for assistance. Turning to today's numbers, I am pleased to report that we continue to see a decline in our overall case numbers. Over the last 24 hours, we identified 422 new cases of COVID-19 and completed about 8,300 tests. That puts our positivity rate at about 5.1%. This is a significant decline from the peak of our rolling 7-day average positivity on September 27th, when it was 11.3%. This decline in community cases is mirrored in the number of cases in schools. Currently, there are active alerts or outbreaks in 211 schools. Of these, only 10 schools had 10 or more COVID cases who attended within the last 14 days while infectious. The number of people in hospital for COVID-19 also continues to decrease. Currently, there are 608 people being treated for COVID-19 in hospital, 128 of whom are in the ICU. While we are headed in the right direction, I want to be clear that this is still a significant number of people in hospital, taxing our healthcare system. We must all continue to support efforts to bring these numbers down even further. And sadly, despite our declining case numbers, Albertans continue to die from this virus. In the last 24 hours, 8 new deaths were reported to Alberta Health. Following a review, as per our usual process, 4 previously reported deaths have been reclassified as non-COVID. As a result, the total deaths will increase today by 4. My condolences go to the family and friends of individuals who are mourning a loss, whether it's from COVID or any other cause. Every life matters. As we have seen from our daily numbers, the single best defense we have against COVID-19 is vaccination. Not only does it help to prevent asymptomatic and symptomatic infection, it also greatly reduces the risk of serious illness, hospitalization, and even death. In Alberta, the odds of being hospitalized with COVID-19 are approximately 8 times higher if you're only partially vaccinated, and 10 times higher if you're unvaccinated. I continue to urge every eligible Albertan to get fully vaccinated as soon as possible, no matter your age or health status. In addition to vaccines, we now have an additional tool to help prevent severe outcomes for those at the highest risk. Alberta Health Services has begun administering a new monoclonal antibody treatment for COVID-19 that was recently approved by Health Canada. Sotrovimab is a new drug that was developed specifically for treating patients with COVID-19 who have mild to moderate COVID-19 symptoms. It is the first treatment to be offered to outpatients in Alberta. For maximum effectiveness, it must be administered within 5 days from when the symptoms begin. But let me stress that sotrovimab is not a replacement for COVID-19 vaccines. Albertans are still strongly encouraged to be vaccinated against the virus, as vaccines are the most effective method to prevent the serious outcomes from the disease. Today, AHS's EMS mobile integrated health teams began administering sotrovimab to patients in their homes who are age 65 and older, are positive for COVID-19, unvaccinated, and who wish to have this treatment offered. Patients in Fort McMurray and surrounding areas will receive treatment in an AHS clinic. Some patients who have received a solid organ or stem cell transplant will also be eligible to receive this treatment regardless of their vaccination status. The treatment is being rolled out across the province in a phased approach, starting with those at the highest risk of severe outcomes like hospitalization. For more information on this program, please visit ahs.ca/COVIDopt.